Orthopedically, one of the biggest problems for our patients' lower cervical motion segments is the development of discogenic instability at the C4, C5, and C6 segments. It's those three discs, the C4, 5, and 6 disc, that we have to protect for our patients as we assign range of motion and self-mobilization procedures. So in this video clip, we're going to show you how to use a simple stretch-out strap or a leather belt at home, works equally well, in order to move above the three segments which typically become irritated and hypermobile. With our patients in a seated position, we teach our patients how to bring the belt down just below the lobe of their ear and just below the base of their occiput. Right now, this belt is around the posterior arch of C1. We then teach the patient how to slide the belt down an inch. It's now over the bilateral lamina of C2. And we can typically go 1 inch lower and get over the bilateral lamina of C3 because in most cases, both the C2 disc and the C3 disc don't show high levels of degeneration and high levels of instability. So here's how to move above C4, C5, and C6. First, we teach the patient to lightly push back into the belt and to move with an axis through their ear to bring their chin down and in toward their throat and to self-mobilize the upper portion of their neck into flexion. Next, starting with the eyes level, we teach the patient how to self-mobilize into extension, where they lift their chin up and away from their throat, and they move their neck over the top edge of the belt. In both cases, flexion and extension, we've minimized most motion through the C4, 5, and 6 motion segments. Now let's look at rotation. We can teach the patient how to move above 4, 5, and 6 with gentle transverse plane rotation, where we just teach the patient to move the tip of their nose to the right several times and to self-mobilize to the left several times. To protect the upper cervical region a bit more, we can teach them a pattern where they side bend to the right and rotate to the left. This minimizes the total amount of rotation occurring through the upper cervical region and will therefore protect the V3 segment of the vertebral artery and will also protect the alar ligament. So again, this is coupled rotation and transverse plane rotation. In both cases, we've done a good job at self-mobilizing our patient's neck without moving through the C4, C5, and C6 segments.